Hello, everyone. Thank you for joining today's presentation. My name is Bill Bjorky. I'm from Fallon Health, which is a healthcare services organization that offers Medicare and Medicaid plans for a variety of ages, incomes, and health conditions. I'm here today to talk with you about Fallon Health's Fallon Medicare Plus Medicare Advantage plan options for Worcester County residents. Fallon Health is a healthcare services organization that was founded in 1977, has been providing Medicare coverage for more than 40 years. We're dedicated to our mission, making our communities healthy. And we offer innovative health insurance solutions to support the diverse and changing needs of those we serve. During today's meeting, I will discuss Medicare basics, the Fallon Medicare Plus service areas, our provider networks, the benefit bank, your plan options, Fallon Medicare Plus benefits and copayments, and how to join. Let's talk a little about Medicare. Medicare has 4 parts. Part A is known as hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans. And Part D are Medicare prescription drug plans. When you become eligible for Medicare, you can choose the way you receive your coverage. Medicare consists of different parts, and each part provides different coverage. So it's important to think about the type of coverage you may want or need now and in the future. Let's take a quick look at this chart. At the top, you see basic coverage, also known as original Medicare. Now, this consists of Part A, which is hospital insurance, and you do have a deductible of $1,484, and Medicare will pick up 80% of the cost, and you'll receive a bill for the 20% balance. Part B is medical insurance, so that's everything else that's not hospital, and this has an annual deductible of $203. After you've met that, Medicare picks up 80% of the cost and you pay 20%. Now, to enhance that basic coverage, what people do is they may go to a Medicare supplement, also known as a Medigap plan, and purchase a separate Part D prescription drug plan. Others may choose to go with the Part C plan, the Medicare Advantage plans, and they come with and without prescription drug coverage. Now, if you decide that you would like more coverage than what's provided by original Medicare alone, you have these options. So we see the supplement Medigap plan on the left side of this page. It picks up the benefits of A and B of Medicare, and it helps you pay for the deductibles depending on which plan you choose. And it also covers things like the out-of-pocket expenses for things like vision care, money for eyewear, gym memberships, as well as some costs that are not covered by Medicare, such as those deductibles. And if you want prescription drug coverage, you would purchase a separate Part D drug plan. Now, the Medicare Advantage plans are private insurance policies that are sold by insurance companies that do provide all of the Medicare original benefits for Parts A and B, and they do provide additional services, such as vision, dental, hearing aids, gym memberships, an eyewear benefit, and more. Now, they also include prescription drug coverage. Please keep in mind you cannot purchase a separate Part D drug plan and have a Medicare Advantage plan. That is not allowed by Medicare. Now, the Fallon Medicare Plus service area includes all of Massachusetts except Dukes and Nantucket counties. And the Fallon Medicare Plus Central service area includes only Worcester County. So you can see by this map that we have outlined the central network. So if you live in Worcester County, you have the option of picking any physician within the Worcester County area or from our statewide or broad network. Now, with Fallon Medicare Plus, there are 2 network options. There's the Central Network and the Medicare Plus HMO network. So if you're a resident of Worcester County, you have the choice of both networks. Please keep in mind your decision should be based on who is going to be your primary care doctor. Who are they affiliated with? At the top, we see the central program, which includes the Reliant Medical Group, Hayward Hospital and its providers, St. Vincent's Hospital, and some select Steward healthcare providers and other local providers. The Fallon Medicare Plus HMO network includes all of those that are listed above, plus the Harrington Healthcare, Beth Israel Lahey, Beth Israel Deaconess, the New England Baptist, UMass Memorial, including the Clinton Hospital, and many other providers across the state. Again, keep in mind who is your primary care doctor when making your decision concerning which of those networks you wish to participate in. Now let's talk about the Benefit Bank. The Benefit Bank is a new program that we introduced, and it has up to $1,000 per year, depending on the plan that you select. And this is for fitness membership, dental care, eyewear, hearing aids. So the amount that you receive depends on the plan that you choose. And you can use the card either for one particular service or in combination. It's your choice. And we'll look at how those Benefit Bank services can be utilized when we get to the next slide. With the Fallon Medicare Plus Central and the Fallon Medicare Plus, you have a choice of 3 plan options: orange, green, and blue. So we first look at the top of the screen. We've got the central benefits for orange are 0, and they have a $1,000 benefit bank. The green plan is $34 per month with a $500 benefit bank. And the blue plan is $129 per month with a $250 benefit bank. The Fallon Medicare Plus plan, orange, has a 0 monthly cost with a $500 benefit bank. The green plan is $120 with a $250 benefit bank. The blue plan is $254 with a $125 benefit bank. There are no annual medical deductibles on any of the 3 plans. Please keep in mind the benefits are going to be the same on orange across the state, regardless of where you live. The orange benefits are the orange benefits. So let's take a look at those benefits. At the top, you see the supplemental physical examination and a wellness visit at no copayment. The difference between those 2 examinations is the physical is actually where you and your doctor have a very intimate examination where he or she is going to look you over from top of your head to the bottom of your toes to check out dermatology. They're going to check your blood pressure. They're going to look at everything that's going on in between. The wellness visit, however, is a Medicare required examination. That is a conversation that you have with your doctor. It might be the nurse practitioner or physician assistant. They're going to be reviewing things like, are you having any difficulty paying for your medications? Are you eating properly? There's a lot of different questions. So please don't be intimidated by the questions, but it is something that Medicare has put together to evaluate how everything is in your household. And the doctors may be able to identify some programs that will be very helpful to you. Next is the primary care office visit. This is a $10 office visit, and your specialist copayment is going to be a $40 charge on the orange plan. We offer the teledoc or the telehealth services, and there's a $0 copayment for primary care, outpatient mental health, and outpatient substance abuse. If you require a specialist telehealth visit, then it's going to be a $40 expense. Again, these would be for non-emergency services. Next is the ambulance. There's a $300 charge for the use of an ambulance. And I'd like to point out on all of our plans, if you're able to be transported between a hospital and a rehab center or rehab back to the hospital, and you can do it in a chair van, there's a $35 copayment for the chair van transportation. You may not need to go on an ambulance. Next is the inpatient hospitalization care, $370 per day up to the first 5 days. So that means 2 days would be $740. And if you're in for the full 5 days or more, your total cost for the hospitalization be $1,850. Next on the list is the diagnostic services. All of our lab work, that's the blood work you may be required to have on a routine or a regular basis. It might be once a year for your annual checkup. And x-rays are covered at 100% on the Fallon plans. Diagnostic imaging, CAT scans, PET scans, MRIs, or nucleus studies are going to be covered for a $300 copayment. Please keep in mind that if you have any of those procedures done while you are in the hospital, those are covered as part of your per day charges while you're in the hospital. But you will not be billed separately for any additional diagnostic imaging that is taking place. Outpatient surgery, this could be something that's done in an ambulatory facility where you're able to walk in, have the procedure, and go home. It might be freestanding someplace. It might be associated with a hospital. Your cost for the outpatient surgery is going to be $350. Good example would be cataract surgery. So if you're getting cataracts and you have both eyes done in the same year, it's going to be a total of $700 for the cataracts on the Orange plan. Next is the worldwide emergency services. So if you are any place in the world, we will cover your emergency services for a $90 copayment. If you're in the United States and can utilize an urgent care facility, that's one that's not an emergency room, you can have that for a $10 copayment, and it's $90 worldwide. Next on this list, it says free Silver Sneaker program. It is not covered by the Orange plan, but we do suggest very highly that you utilize your benefit bank dollars to join the health club of your choice. There's no network restrictions as long as they can process that MasterCard that we just showed you. You can utilize your benefit bank dollars. And prescription drug coverage is included, and we'll get to that on the next slide. Next is the mid-range plan. It's our green plan. Again, no charge for the physical or the wellness visit. You do have a $25 copayment on the green plan for your primary care office visit and $40 for the specialist. There's a zero cost for the teledoc for primary care, outpatient mental health and substance abuse, and $40 copayment for your specialist visit. Keep in mind, again, these are for non-emergency visits. Next is the emergency ambulance services. These are going to be covered at $225 per trip. Also, a maximum of 4 times per calendar year in the event that you need to have an ambulance. Next is the hospitalization. And the cost for hospitalization on the green plan is $300 per day for a maximum of 5 days, or $1,500 on the green plan. Diagnostic services, again, lab and x-rays covered in full. The MRIs and CAT scans, the price is only $250 copayment, and a maximum of 4 times per year would you pay for those particular services. The outpatient surgery is $275. The worldwide emergency services are $90 on the green plan, and urgent care is $25 in the United States and $90 worldwide. This program also includes the Silver Sneaker membership, and that is a program that offers 14,000 locations across the United States where you can utilize their services. It might be someplace that has exercise, it might be different types of programs, it could be a pool, it could be a racket and tennis club, for instance, over in Shrewsbury, quite a few locations. And this program does include prescription drug coverage. So we jump over to the blue plan. Again, the annual physical and wellness visits at no charge, $10 for the primary care office visit, $20 for the specialist. The teledoc services, again at $0 for primary care, $20 for the specialist. The ambulance services are $125, a maximum of 4 trips per year that you have to pay for. Keep in mind, again, that chair van opportunity, if it's something that will work for you. All plans for $35 copayment. And on this plan, it's uniquely different in that it has a flat rate for the hospitalization. And that amount is $200 copayment per admission and a maximum of twice per year that you'd have to pay for hospitalization on the Blue plan. The diagnostic services, those lab and x-rays, no cost on the Blue plan. The diagnostic imaging, those expensive CAT scans, are at $150, a maximum of 4 times per year, or $600. The outpatient surgery is $120 on the Blue plan. The worldwide emergency services at $120, and urgent care at $10 in the United States and $120 out of the United States. The Blue plan includes the Stover sneakers and it includes prescription drug coverage. So let's take a quick look at the prescription drug options. They're available for both retail and mail order. On this slide, we're going to review the Part D prescription drug costs for the preferred and standard pharmacies. The orange and green plans have a $300 annual deductible that applies to drugs in tiers 3, 4, and 5. The Blue plan does not have a deductible. Next, we see the prescription cost co-shares for 30, 60, and 90 days. With the retail pharmacy, please keep in mind that you pay for each of the levels that you're getting the prescriptions. We'll see some advantages to having them come in by mail order on the next slide. I'd like to point out that the Tier 1, starting this year, has no copayment for a preferred pharmacy. And a preferred pharmacy includes the CVS pharmacy, Walmart, the Big Y, the Stop and Shop, and quite a few other independent pharmacies across the state. An example of a standard pharmacy would be Walgreens. Now, you can utilize any pharmacy if you're out of the area, and you'll just pay a different copayment each time you get a prescription at a standard pharmacy. I would like to also point out that the Tier 6 includes prescriptions for people that are in opioid treatment programs, and it also includes the vaccination for the Shingrix or shingles. So if you're someone that has not yet had a shingles vaccination, the Shingrix program is a 2-dose vaccination, might be something that you would want to consider. Now, let's jump over and take a look at the mail order program. And again, I'd point out that the deductible applies to a combination of the retail and mail order. So if you're getting those medications that are tiers 3 through 5, whether you get it at a pharmacy or you get it through the mail order program, your annual deductible on the orange and green plan is going to be a combined $300. It's not on each of the different ways that you get your medications. So the program will provide you with a 90-day supply, and you pay for a 60-day equivalent copayment. So you get 1 month free when you utilize the mail order program. And that's available both through the preferred pharmacy, which happens to be Caremark, will be the folks that ship the medications to you through our preferred pharmacy network. And you can use any of the different pharmacies for these if you're utilizing a standard pharmacy. Now, the specialty drugs, Tier 5 and Tier 6, are not available for more than a 30-day supply. I'd like to point out that there is a coverage gap with all prescription drug plans. So that includes the Advantage plans that we're talking about today. Now, not everyone will enter the coverage gap. And the coverage gap is determined with the amount of money that you and the insurance company have paid towards your prescription drugs. And when that amount reaches $4,130, you are in the coverage gap. And at that point, instead of paying those lower copayments, you will now pay 25% of the cost of the medication for brand and generic medications until you reach a total of $6,550. That is considered the end of the coverage gap. Now, not everyone reaches that coverage gap. Keep in mind that if you're currently in Medicare and on a drug plan, and your medications are about the same as what they're going to be with us, you'll probably hit that coverage gap about the same time each year. So if you either add or delete any of the medications, then the time that you hit that coverage gap could change. So what happens? You drop into the catastrophic coverage level. And at this point, you then pay the greater of either 5% of the cost of the medication, or $370 for generic and preferred brand names, or $920 for all other medications. Now, with the Fallon Medicare Plus, you also get benefits like the telehealth services that I've already described for non-emergency conditions. You also can get hearing aid, which includes one supplemental routine exam every year and coverage for hearing aids with a copayment varying from $695 to $995 per device through Amplifon, and that's one device per ear every year. So you want to contact our customer service department to find out where those providers who are part of the Amplifon network are located. They would be the ones who would do the testing. They would order the devices for you. They would help with the fitting, and they would do any repairs that are needed and follow-up visits. So our devices come with 2 years of batteries and a 3-year warranty on each of the devices. Next, you see the vision care listed. We provide one supplemental routine exam and $150 allowance towards the purchase of new eyeglasses or contacts, frames, lenses, fittings, and upgrades. There is a network called iMed that you'll want to utilize to get that $150 benefit. And you can also utilize your benefit bank dollars if you choose to get the eyeglasses at some other facility or location who may not be an iMed provider. And finally, on this slide, we see the fitness benefit. As I mentioned, the Silver Sneakers is a national network of gyms, and it's available for people on the green and the blue plans. So if you're an orange plan member, or if you're green and blue but want to go to a different location, a good example of that might be Planet Fitness or something like that. They're not in the Silver Sneaker network, so you may want to use some of your benefit dollars to have a different gym membership. It's up to you. Again, those benefit dollars are yours to use as you see fit. Now, dental services are available on the green and the blue plan. The coverage includes preventive care like cleanings, routine exams, and x-rays for a small copayment of $25, and that's available twice per year. There is a dental network that's utilized. However, if you wanted to go someplace else or use some other plan benefits, if you have something through a spouse or something, you can use the benefit bank dollars to help pay for those things. The orange plan has no dental benefits at all, so you may want to apply some or all of your money on the benefit bank card if you're an orange plan member. We also offer a free 13 consecutive week WW, that's the Weight Watchers program. We also offer free 24/7 access to a registered nurse by telephone who can evaluate your symptoms and recommend that you either go to the emergency room, an urgent care facility, or try to reach your doctor, or to use the telehealth services. Now, it's easy to join the Fallon Medicare Plus plan. To be eligible, you must be enrolled in Parts A and Part B, which means you must continue to pay your Part B premium if not otherwise paid for under Medicaid or by another third party. You must reside in the service area, and you have options on how to enroll. You can either go online to fallonhealth.org/Medicare and enroll there. You can enroll through Medicare's online enrollment center at medicare.gov. You can enroll over the telephone by calling Fallon. We can help you at 1-888-377-1980. That number will be up in another slide or so. And you can fill out a paper form that's included in the enrollment booklet. We'll be happy to provide those booklets to you. Just give us a call and we'll send one right out to you. Now, enrollment in this plan will automatically end your enrollment in another Medicare Advantage health plan or a Medicare prescription drug plan. So if you're enrolled in any other type of Medicare health plan, including a Medicare supplement, you'll need to notify them that you want to disenroll prior to the effective date of enrolling in a Medicare Advantage plan. And once you're a member, you have the option for how you pay your premiums. You can either receive a bill monthly, you can have it come out of an automated deduction from your savings or checking account known as an ACH. You can have it come from a credit card, and we accept Discover, MasterCard, and Visa cards, or you can have it automatically deducted from your Social Security or your Railroad Retirement Board benefit check. And please keep in mind that if you have a late enrollment penalty, the amount would be added to the amount you pay with each monthly premium. Now, here's a list of resources and contact information that you can use to get more information. Medicare is 1-800-633-4227, and Medicare.gov is a wonderful website that has interactive tools so you can look up, is a particular service covered, and you can also enroll in Part B if you have not yet signed up for Part B. Next is the Social Security Administration at 1-800-772-1213. And I've listed the Massachusetts Medicaid office at 1-800-841-2900. They have a program called Prescription Advantage that you may want to look into. For people with high prescription drug usage and an income below $80,000, there's a program available for you through the Prescription Advantage program. Now, to get more information on Prescription Advantage, you may want to contact the local Cheyenne counselor who works at your local senior center, the Council on Aging. You can call the facilities and they will get you in touch with their Cheyenne counselors, and they'll schedule an appointment for you to either come in personally if the centers are open, or you may do it by telephone, but they can assist you with applications for programs like Prescription Advantage. And finally, last but not least, Fallon Health is here to serve you. We're at 1-888-377-1980. You can speak to one of our representatives Monday through Friday from 8 a.m. to 5 p.m. We're very happy to assist you with any questions you may have, to do an enrollment, or whatever it might be to help your decision concerning your Medicare needs. And you can go to our website, fallonhealth.org/Medicare, and learn more about our particular programs. Now, I have a few more details before we wrap up this presentation. Fallon Health is an HMO plan with a Medicare contract, and enrollment depends on the contract renewal. So this completes the presentation today. I thank you for sharing some time with us, and please give us a call if we can be of any assistance, and we look forward to talking with you or having you join us as a member. Have a great day.